Good evening, everybody. Welcome to the Governance Committee, the November one, and hope you're all keeping reasonably well. Have we got any apologies for absence, please?
Yes, Chairman, we have an apology from Councillor Laura McCarthy.
No substitution? No. Okay, fine. Thank you very much. Declarations of interest? None I see. Questions and deputations? Again, none. Minutes of the meeting held previously. This was on page 5 and 8 of the agenda, and asked to approve the minutes of the last meeting as a correct record. Everyone happy with that? Thank you very much indeed. Right, we come straight into the flexible working policy, and we have Helen Flinter, who is going to run through this for us. In fact, she's dealing with both of the agendas this evening, and they seem to be fairly straightforward, but let's hear from Helen. Thank you.
Thank you, Chair. The first paper to just refer to is the flexible working policy and the proposed changes. So we're looking to share those proposed changes with Governance Committee and seek approvals. Effectively, with the flexible working policy, the review was undertaken in parallel with a piece of work that looked at hybrid working for the council. So in terms of returning to our workplaces and hybrid working in line with service needs and the individual, we wanted to also take the opportunity to look at the flexible working policy, because we recognise that not all of the employees have the opportunity to work in a hybrid way. And the flexible working policy will really come into force where those roles don't offer hybrid working. Effectively, this will mean that staff can still request flexible working in their role. And the difference here is that our current statutory position is that a flexible working request can only be made after 26 weeks of service. Whereas hybrid working can be an arrangement agreed with the manager without a formal application. And what we wanted to do was to look at this in conjunction with wider government consultation with regards to a piece of work looking at actually making a change to the flexible working legislation that would see employees being able to request flexible working from day one of employment. So we felt that rather than wait for that consultation to be concluded, our policy stance was to set out that we would like to align that from a day one right under flexible working from now. We feel that this aligns better with our approach to hybrid working, but also it offers flexibility to our employees, and it also maximises the opportunity to ensure when we're recruiting and retaining employees, we have additional sort of offers to make as part of that employment contract. The paper sets out a number of areas that we did consider as part of this review, but the fundamental change is around changing the policy to request flexible working from day one of employment rather than waiting for 26 weeks. So I'm going to just pause there and invite any questions or comments. I think from our perspective, we feel that you know, in the very unlikely position that this didn't become legislation, we do feel that it is best practice, and it would give parity to employees across all roles to have the opportunity to request flexible working in one shape or another. Thank you.
Any comments from any member, please? One thing I'd like to ask, if I may, seeing that nobody jumped in quickly, are we curtailing or not looking after our residents in the same way as we used to? When, if somebody rang up the council and they wanted to speak to, say, someone from highways over some urgent matter, are we going to have sufficient people in-house who will be able to answer some of the questions that may be being sought by residents? I mean, we as councillors, we do have a direct line and very often can speak direct to an officer at home. But are we going to be sort of losing the service that we've been very proud to give the residents of Solihull in the past?
I think in terms of hybrid working, any arrangements that come into play would need to be balanced with the service needs. So this is not saying that the balance of that position changes or moves to the employee. It's about looking at the what the service can accommodate. So I would expect that as part of that discussion that those conversations happen so that the service isn't compromised. With regards to the flexible working policy itself, just because somebody puts in a request doesn't mean to say it's going to be approved. But what it does do is give the opportunity for the manager and employee to explore what is possible in the context of the role and in the context of the service before any agreement is made. So in some respects, it could actually enhance the service to residents in terms of the flexibility that we afford our staff to actually provide the service in a different way.
Thank you very much for that. Councillor Grinsell.
Thank you. I'm wondering if there are any controls in place in order to oversee that the remote working is actually done, because we all know that remote working means that you can multitask and cook dinner and do this, that and the other. Are there any controls in place?
So the controls would be, I guess, first of all, our core principles are around trust and flexibility. And at the end of the day, we're looking at how work is done, where work is done, and the outputs. So whilst we're talking about hybrid working and flexibility, in the same way that home working is actually an option pre-pandemic anyway, the controls would be that the manager and the employee are still in sort of close contact. You still have the same meetings. There would still be an expectation that teams come together on a flexible basis and face to face as and when needed and required. So I think what we're trying to sort of do here is shift the emphasis around, whilst we talk about remote working, it's not necessarily working from home, it's just working in a more flexible way. And that remote working could actually be from a different location rather than at home, but appreciated it could also include and does also include working from home.
Thank you, Helen.
Thank you.
Are there any other questions at this point, please? Josh.
Not so much a question, more a comment. I'm happy for these changes to be approved. I know a lot of private businesses have already updated their own policies similar to these proposed changes. So we don't want to put ourselves at a disadvantage when recruiting ourselves. And so long as productivity doesn't fall while working from home, I see no reason why more people shouldn't work from home if they can and they want to, if that provides them a better work-life balance.
Anything further to add, Jeff? Helen, sorry.
No, thank you. Not from me, thank you.
Thank you. Thank you, Helen. What I did want to say is one of the things that I've noticed with the actual document was I enjoyed reading about the best practice, and I think it's really suitable in the kind of new normal and how you've gone forward with it. So yeah, I really do like the idea of hybrid working, and I like the fact that, you know, employees and their well-being is taken care of within this space. But thank you. Thank you, Chair.
Thank you.
Thank you. Any other questions at all? Observations, comments? None at all. Is that it, Helen?
Yeah, I guess just really if the committee is happy to approve the changes so we could take that forward.
Right. Well, we've got before us asking us to support the recommendation, and I'm hoping that you will all be agreeing to this. Please show. Thank you very much. That has been passed. Thank you.
Thank you.
We then go to the next item, which is the sickness absence management. And again, Helen has got this one to deal with. Thank you.
Thank you, Chair. You'll have read from the paper that the sickness absence management policy was reviewed way back in September 2018. And as part of that review, it was agreed that we would do a formal review 12 months following that date, just to look at the impact of those changes. That review commenced, but it was paused following COVID and various other shifts in priority. So we've resurrected the review, and we've looked at the initial feedback, and we've looked at it alongside some of the other emerging themes around sickness absence. We've got a new sort of reason for absence that we didn't have prior to the pandemic. We've looked at it in the context of hybrid working, and we've also looked at it in the context of the council's priority to promoting employee wellbeing. So that the scope of the review has widened somewhat. But the key changes to the actual policy and the supporting documents that include manager guidance and FAQs are really around strengthening the thread of wellbeing through everything that we do. Actually aligning it to the council priority now of promoting employee wellbeing and all of the work that's happening around that. As well as some of the more technical aspects of providing clarity of how you move through formal stages of the policy, looking at sort of some of the language that was used in the original policy and the impact that that may have on individuals, such as using the words targets. We've picked up feedback around discretion and flexibility where that is appropriate to apply. And we've also looked at sort of other sort of aspects of tightening up some of the guidance in terms of how that's applied. You'll notice from section 4 of the paper the impact of the new trigger points that were introduced into the policy in September 2018, in that at that time, absence was running at a rate of 8.2 days per FTE. And that then reduced just prior to sort of going into sort of pandemic to 7.78. So the impact of that did reduce absence slightly. Clearly over lockdown, we weren't sort of mingling as much. We were working sort of in a very isolated way, working from home, and that obviously had an impact on reducing absence further. And what we're seeing now as more employees come back into the workplace is that is starting to rise slightly, and I think that is to be expected as we, come together again, and there is the opportunity for, I guess, germs and viruses to mingle. So the original targets that were set, we felt were set at the right level. The other aspect that I just wanted to highlight that shapes some of the changes in the policy is around mental health absence. You'll see that is still the biggest cause of absence for the council in terms of percentages, but when you look at the actual number of days lost through absence, that is actually reducing, and it is at a lower level. That said, personal stress is the most significant element of mental health absence, and was the case in September 20 as well. And COVID, our new sort of absence reason, is now the second cause of absence across the council, equating for 11% of all absences compared to 4% this time last year. So what we have used is that feedback and that evidence base to shape the policy to make stronger links with sort of mental health, the work that's happening around employee wellbeing, earlier referrals, the support that we want managers to give to employees, but also recognising that there are still some unknowns there in terms of COVID and the potential longer term effects of COVID. So those were the main factors that have shaped the key points around the policy itself. what I'd like to do is just sort of pause there again and just sort of take any questions on the detail of the changes that we've made or are proposing to make in the policy.
Thank you for that. It is encouraging to see this report, to be perfectly honest. I think so anyway. And of course, the unions are fully supportive as well. So that again is encouraging, but the percentages are quite low to what they used to be during a very serious time. But I think your point is right, that people working from home are less likely to pass germs around as if they were in an open office. Anyway, any questions, please, or observations? Councillor Caldwell, please.
Thank you, Chair. Yeah, I just had a couple of questions. Firstly, well, they're both on 3.6, actually, Helen.
Yep.
That second bullet point, that the long-term effects of COVID-19 will need to be considered, including that absences due to COVID-19 should be disregarded from trigger points. I think it's obviously good and right that that's the case. Do we, or have we thought about extending similar consideration for other transmissible illnesses? So I'm thinking influenza or norovirus or things like that, because frankly, I wouldn't want people with flu in the office for exactly the reasons that you've set out. So it seems that actually it does the business a favour to ask people to stay home instead of punishing them for doing so. And especially when we have improved hybrid working arrangements, you'd think that actually you might be able to get work out of people even if they're a bit under the weather potentially. So is that something that we're thinking about doing?
I think there's 2 points there, Councillor Caldwell. The first one, I guess the driving reason around excluding COVID-related absence at this point in time from trigger points is because there are a lot of unknowns, and we want to understand that more in terms of the wider impact on employees and the workforce. And then the second point is really just what we want to do is to ensure that whilst we're working in a hybrid way, and for those that are working from home, if they're not fit for work, what we don't want to do is to encourage a culture of working if they're not fit for working. I think the level of tolerance could be quite different to somebody who has to then travel to a workplace to, get on a train or in a car. But what we wouldn't want to do is to see employees who are not fit for work working irrespective of their workplace. So if they're at home, and they're not fit, then we don't believe that they should be managing their well-being and their health in that way rather than working through it if they're not fit to do so. And those are the considerations there. Does that answer the question?
Yeah, it does. And to be fair, I think I might have slightly misled you and the committee in what I was saying. I wasn't suggesting that we force people to work if they're not well enough to do so. It's just more a question of, I mean, I've been in that situation, I'm sure we all have, where you've got a bit of a cough. You think you probably shouldn't go in, but it doesn't mean you can't do anything.
Work.
So I guess it's just a question of how do we want to manage that going forward. Second point I had, the new section on domestic abuse. I couldn't actually find it in the policy.
Yeah, and apologies. It's in the guidance document, which I haven't circulated because it's an operational document. So in terms of letters that managers use. But effectively, what that talks about, it makes a stronger link to our domestic abuse policy. It encourages individuals to speak to their line managers or line manager. And also the other point here is around absences relating to domestic abuse. They will not be used, I guess picking up on the point that you've just sort of referenced earlier, they wouldn't be subject to the normal absence management triggers. We strongly encourage managers to seek support from their HR advisor around that. So it's strengthening the link with the policies and connecting the two together in a more aligned way.
Thanks, Helen.
Thank
Thank you very much. Councillor Grinsell.
Helen, yeah, thank you. Help and advice, really, and just something that's recently happened within my own business. As I understand it, statutory sick pay is not applicable if you earn less than a figure per year. So I'm wondering, those people who maybe do a couple of days a week, 3 or 4 hours a day. What effect has this on those people? That's the question. Is there any effect on these people, on those people who are on quite low salaries and low hours?
Yeah, you'll have noticed from the paper or from the policy, we refer to a separate document again called our COVID-19 management guidance, and that point is very much covered there, but it's applicable to sort of wider reasons for sickness absence, whereby you have to earn sufficient pay to actually qualify for statutory sick pay. Where that's not the case, what payroll will do is provide the individual with the documentation so that they can claim the sickness allowance. So there is a connected process there to capture those individuals that do not qualify for statutory sick pay because they are earning under the lower earnings limit.
Helen, thank you for that. That means that I've done exactly the right thing in the recent past. Thank you.
Thank you.
Right, we have another question from Councillor Ashraf, please.
Hi, Helen. One of the questions I wanted to ask was around the menopause that you had written in the document, as well as if the absences are related to like menstrual cycles as well, like dysmenorrhea, which can be chronic and can happen every month, and therefore women take over time, I guess 2 days in a month, 3 days a month, and if that is part of the rotating sickness, noted as rotating sickness.
It is, yes, and just before lockdown, we actually brought our menopause policy to governance committee. So we took a step forward and actually put a policy in place around menopause and the support that was available to staff, including some training and sessions directly with individuals, because we do see that as a very important sort of area. Sickness relating to menopause would count as sickness absence under the policy, but what we do is we do manage that with the individual as such, and it's like we have to look at things on a case-by-case basis, and that is why we obviously record reasons for absence as well as duration of absence. But we did take that step forward in terms of having our own menopause policy, which I'm happy to share with you. Sort of as a colleague who has raised that question, we can share that with you as well.
That would be great, Helen. So in that instance, what happens in the instance where staff are taking annual leave as a result of menopause? How is that noted? Is that noted somewhere? Because it is a kind of inequality impact towards women, particularly around gender.
I guess if it's noted as annual leave, but the manager doesn't know that's the core reason, and I guess that is one of the reasons why we want to encourage people to talk about it, and whether it's your manager or a HR advisor or another manager, because unless we were aware of that, we wouldn't be able to flag that. So it would be noted as a reason for absence would be annual leave if that is what is requested. Yes, there could be potentially a pattern there recurring in there as well. So yeah, and one of the pieces of work that we're doing around sort of the menopause is looking at sort of how we develop our own network as well internally for individuals who want to come together to talk about shared experiences. But relating to the sickness policy, it would be counted as sick leave and counted towards the triggers. But in managing that, we would look at the reasons and how that individual can be supported. And the point here around discretion in the policy, that's probably an example where we might choose to apply discretion in terms of how we move somebody from a stage 1 to a stage 2, for example.
I think the final question is, Helen, is this particular document supported with a kind of an equality impact assessment as well?
It is,
Yeah.
yes.
Okay.
Yeah.
Were you going to say, would you like a copy of it?
Yeah, I was going to say, if you'd like
Yes,
me
please.
to. Yes.
Yes, sorry, not to finish your sentence, but yes, please, that would be great.
Thank you.
I think because then that works hand in hand with, works well with what we're trying to work on as well. So thank you.
Thank you.
Any further questions for Helen, please? Councillor Davis.
Thank you, Chairman.
Just 3 points, or part point, part question. In that second bullet point at 3.6, which Councillor Caldwell referred to, I think, it says that the long-term effects of COVID-19 need to be considered, including that absences due to COVID-19 should be disregarded from trigger points. Does that mean, if I'm interpreting that correctly, that the figure for people who are absent through COVID will not be reported?
It will be reported, and as I've said in the report, we can actually track the level of absence related to COVID-19, so it would be recorded as an absence. In terms of applying the sickness policy to absences relating to COVID, so looking at the trigger points, we wouldn't include the trigger points in that. So if we were looking at, is it appropriate to hold a stage 1 meeting or appropriate to move to stage 2, at this point in time, what we are proposing is that we don't include those trigger points in that process, but the absence would still be recorded, so we can see how much of our absence is related to COVID. Does that answer the question?
Right, thank you for that one. Removal of the word targets, which I'm all in favour of. What will you put in its place?
Okay, so the emphasis here is more about, rather than not having X number of days absence over a period of time, it's looking at, for example, when an employee comes back to work, how is that absence or how is that attendance sustained? So what we're looking at in terms of a return to work interview and review meetings that go forward, it's about employee wellbeing and the sustainment of attendance rather than a target, quite a blunt target that was the case before.
Would you use the RAG system?
The
RAG?
we don't use that at the moment.
But is it something you would consider, do you think?
I probably need a little bit more information, I think, from you in terms of how you would see that linking to this piece of work.
Okay, it's just a thought.
Okay.
And it's good to see that the absent levels went down to 6.34 days, but it's risen slowly in September due to the rise, of course, in COVID cases. Would it be an idea, say you get a true reading of absentees, to report COVID cases separately?
So we do actually report, so each month we will report absence, and part of that we can look at what proportion of that absence is related to the different reasons, so that we can see where they are and are they increasing or are they decreasing, or what is the impact in different service areas. So that information is available and it is reported separately. As I say, COVID at the moment is our second top reason for absence across the council. It equates to about 11% of our absence. Good. Compared to, I think, 4% this time last year. So we were able to extract that data.
Yeah. Thank you, Helen. Chairman.
Thank you.
Thank you, Stuart. Any further questions to Helen? No? Well, thank you, Helen, for these 2 reports. I've often heard from staff that they feel that we're a good employer. And I think, again, we are adding to that with the updating of the policies. And thank you for your time this evening. Could I have support for the present policy before you? And that's unanimous. Thank you very much indeed. So within half an hour, we have decided on 2 important decisions for staff members, and that is encouraging. So again, thank you, Helen, for your time this evening. It's coming up to 6:30, and good night, and thank you for your attendance.
Thank you.